Hey, it's Dr. Aaron Smiley. Just wanted to show you how I do virtual care, how I use Medici to offer virtual care in a couple different cases. So this first case, I'm using my browser on my computer. Most of the time in practice, I'm using my cell phone, but for demonstration purposes, it's a little bit easier for me to use Chrome on my computer. So this first owner is presenting December 31st, and then it's time stamped. And on your mobile device, it'll look a lot the same. This dog had been seen previously for swelling above the eye. The owner was insistent that it wasn't a tooth abscess. He wanted to try to be as minimalistic as possible. So we tried a round of antibiotics. The swelling went away, then it returned. And so he's messaging me onto the 31st with this concern. So he texts me. The dog has a bump that popped up, not painful. And then he sends an image. Now, on your mobile device, when you get these images, you can click on them and they'll just pop up. On the desktop, they'll download as downloads. So then you can just see here. So we look at this and we can tell there's a little bit of swelling right here. Not a great picture. So then he sends another picture. It's this thumbnail, and then it'll download. So we look at the second picture. There we can appreciate the swelling more. Now, this is a dog that we have a VCPR with. I've seen this dog. It's in regularly, so as far as legality goes. So then just looking at the timestamps, he says that at 9:43, and then I come down, I get a message on my cell phone, and I respond at 10:11. The other thing that you'll notice is right here is I added the Devonshire triage team. So all my nurses and technicians in the front desk can log in as the triage team. And so now they can see exactly what's going on. You can do this with other doctors. You can do it with your nurse staff, however you want to include them. And if you're the coordinator of the group, so the client sent me a message, I can add up to 8 different professionals. And I can take them away as well. So if I'm in charge of the group, it's just like a texting group. I said, great job with the walk. And you want to make sure that you're doing that, encouraging people. We all know as far as with the written communication, text message, or, in the really olden days as far as writing, but give people positive affirmation because you can't convey emotion when we're typing it out like you can in the exam room. I said, now helping me remember, did the bump go away completely after we started the antibiotic in November? He said, yes, it did. I said, okay, let's repeat the antibiotic. We might want to consider taking x-rays of that area to make sure that there isn't some type of foreign body. And the owner was insistent that they go on all these hikes, and so that most likely she got a splinter or something in her face, does not have a tooth root abscess. And there was no gross pathology that you could see in the mouth, so just kind of let it work out. I said, I'll have the staff get an antibiotic ready, but we may want to take some x-rays. We're closed for the New Year's. Are you able to get to the clinic before noon? And then he said his wife, Deb, can make it. Again, we're watching the timestamps. The other thing to appreciate here are the 2 checks. So like in WhatsApp, 1 check means it's sent, 2 checks means it's sent and seen. I said, great, keep me posted on the swelling. I want to make sure that it goes down after we start the antibiotic. Let the front desk know if you want to schedule an x-ray of that area, if there's some type of splinter that's causing the chronic swelling. All right, I'll push the virtual care fee. Let me know if you have any additions. All right, so now that's at 10:32. And so what I did here is I'm going to push this green button, and I won't do it right now, and I'm going to go end and bill. And that's all I did. On my mobile device, I did that. And you go through a couple steps I'll show you on another patient. You go through a couple steps as far as you generate notes, and then you push the fee. You can do a fee, totally up to you can make it whatever you want to make it. There's no restraints on that. Or you can do a free consult. So just viewing the details of this, I billed him $30. My note was facial swelling. And then this is created then into a PDF. All right. So what you do is now in our clinic, we use Slack a lot. So the PDF gets sent to Slack, and then they attach that into our medical records with Avamark. But you can do however you want to get that PDF into your medical records. That's all you have to do. Now I have this green check mark here because I have a person. Her name's Mia. She does a great job. She is logged in all the time just to keep track. So it's like a virtual care manager. And so she knows when this green check. Let me know that she has attached that into the medical record. All right, and I billed the owner. The owner was billed on his credit card. He had to enter in his credit card information before he got started, and he is very well aware that the cost for a consult here is $30. We get to January 3rd. Now I have Mia again. She's my virtual care manager. She checks in. Super easy. as far as to do rechecks. Very painless versus calling people. Oh, he says it's not getting much better. We need to have it checked out. Wouldn't be the earliest we get in. Prefer Dr. Smiley, but not possible due to West. And I think it'd be having checked out as soon as possible what's best for her. All right. And then I responded. I said we should have a time early next week. Let's make an appointment so that we have time to sedate and take x-rays if needed. I'll have the front desk send you some times tomorrow morning. Now, this is brilliant because my front desk can watch this whole thing. I don't have to interact with it. He says, thanks for the prompt response. Unfortunately, early won't work. So he's talking about his schedule. All right, but he can have his wife download or drop her off. Great, that's an option. And I use about 4 or 5. You can see there I use the thumbs up. I use about 4 or 5 different emojis. Thumbs up, smiley face, a half frowny face, and then like the trumpet with sequins coming out. Or not sequins, but streamers. And I think that it's relevant. Pick 4 or 5 emojis that you think are professional and appropriate, but it does help. It can convey that emotion. So then I said, I'll have the front desk coordinate a day. Congratulations on the new job. Thanks so much. Now here, I closed out the consult. That was free. Right? So it was just an update. I'm not going to basically charge him to make that appointment. Now you can do whatever you want. If you want to continue to charge the client for that interaction, you can. Historically, that's just not how we're doing it here, but Medici gives you that freedom. So now Saturday, January 4th, my triage team, so this is not me, says, hey, Kevin, it's Connie from the front desk. Would it be possible to stop by? Yes, I can. Again, now this gets closed. Free consult. Because we want all of that information to get attached into the medical record. Mia is doing all of that work in the background. He says, I have Monday morning. And you can watch the timestamps on this one. So 9:17. 9:53, so maybe a little bit fast to close that consult out, but it doesn't make any difference because we're doing it's a free consult. And actually, if you see here, this green check, and that's just an emoji that we use. You could use whatever emoji you want. Mia attaches this consult even after these 2 messages are sent, this one and this one. Okay? All right, so now 11:03. I wouldn't feed Allie her breakfast Monday just in case we want to sedate her. So front desk is taking care of that, and he says understood. Now this is the day of the appointment, January 6th. We're in the dental. Lo and behold, shock above all shocks. The dog has an abscessed tooth. All right, so my nurse sends that to him via Medici on her own device. And my technician or my nurse then says, this is Allie's x-ray. Dr. Smiley will let you know what he found out. Because again, we treat this just like we do in the exam room. My nurses are not allowed to diagnose or prognose or prescribe. So she can attach it, but she's not going to prognose or diagnose a tooth root abscess. Allie's doing well. The x-rays revealed a tooth root abscess. We're going to extract the tooth. That should fix the problem. Here, my emojis, smiley face, thumbs up. And I knew that he would be a little bit embarrassed when I said that because he was so insistent that the dog didn't have a tooth root abscess. So again, I sent him another image. It's the same as before, but on my cell phone, I just used the markup feature and then circled. For a novice, I mean, he might already be able to appreciate those abscesses, but I want to make sure that I'm making it user-friendly. Understood. The 2 areas that I circled are the tooth root abscess. He says, got it. And you can watch the timestamps here. Yes, she might have a little bit of blood. Will she be able to function normally? I said she might have a little bit of blood in her mouth, but that will typically go away after 2 or 3 days. Thumbs up from him. Now, we look at 11:41. We cleaned Allie's teeth and extracted 1 tooth today. She's doing well. She can be picked up between 3:30 and 5:30. Again, a very, very easy way to get a hold of the owners asynchronously, especially with owners being at work, versus a telephone call. This is far easier for our clients to interact with us via text message on Medici. This then gets closed out. This is a free consult because we're just giving surgical updates. And Mia attaches it to the medical record. Now, Mia follows up with him January 8th. Hi, this is Mia. How's Allie's doing? Thanks for checking. She's doing well. Obviously, Monday evening was a little rough. Great. And again, so this surgical, people are so thankful that we check in on them, and it's very low stress. I shouldn't even say low stress. It's very easy for us to engage because it's asynchronous texting. We don't have to sit down and make telephone calls. And most of the time that we're making telephone calls, it's, we're playing telephone tag. I give him a thumbs up and a smiley face, and then he just says something nice, blah, 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 and that's the end of it. Now, this just happened. right prior to the video that I'm making. So at some point, Mia will close this out and attach that to the medical record as well.